Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam. Hello, so in this video we're going to go through the assessment station for Mental Health OSCE exam. So you will have 20 minutes to complete this station. You will have an actor in the station who you'll be carrying out the assessment on, and obviously you'll have your examiner. So before you start the station, they will give you a document. I'll put up on the screen the one from the mock exam, which is called the Assessing Care. And that gives you a background of the patient, their diagnosis, past medical history, all of that. Important thing to note, on the front of the document, it will tell you where you are, where you're working, and what the time is. So this is a 3-page document. On your third page, you're going to have some lines and different headings. I'm going to show you a picture. So this page is not marked. This is for you to write any notes on that you have. There's a few different headings there. If you run out of ideas or your mind goes blank, you can use them as ideas to ask the patient about. The other thing you'll be given is the PHQ questionnaire. We will be making another video soon about that, but it will already be pre-filled, so the patient would have already circled whatever answers they are. Then what you need to do is make a total of all of the answers and go through the results with them. So on the back of the chart, there's treatment recommendations, and you pick that according to the score and explain to the patient what the result is and the score. Okay, so that's what your paperwork you're going to get. So to start off the station, you will have all these given to you within the time frame, so you're not going to get extra time to read them first. So obviously do read them, but don't spend too long. I'd say 5 minutes max. Okay, so to go through your station, obviously we're going to go through and use the marking criteria. So when you enter the environment, you're going to check the scene is safe and the patient has privacy. So just verbalise that to the examiner. So I'm checking the scene is safe. I would shut any doors or curtains so the patient has privacy. Then you're going to decontaminate your hands. So good hand gelling with the 7 steps of hand hygiene, explaining what you're doing. Then you need to ID the patient, checking it against your documents. So you can ask the patient their name and date of birth. If they have a wristband on, if it's a hospital setting, you can check that as well, the hospital number. If not, you can ask the address. You can also check the allergies there as well. And obviously you're going to introduce yourself to the patient and gain consent. So just explain, hi, my name's Beth. I'm doing a little assessment on you today. Is that okay? Something straightforward like that. So at this point, if you haven't already done so, I would just quickly calculate your PHQ score. So you can do it with the patient, that's fine. You can just say, just give me a minute, I'm just completing this paperwork, and then go through the results with them, explaining the treatment recommendations as per the back of the chart. You can also discuss with them various different things, so their diagnosis and what's going on with that as per your assessment paper. Anything you find relevant there, like relevant past medical history or social background, anything like that, please discuss it. Compliance with medications, another good thing to discuss. Okay, so point 11 on the marking criteria says, conducts a holistic mental health assessment using the recovery care model. So those are the headings that you have in that assessment, assessment chart where you can make your notes. So just make sure you've covered off all of those if you haven't already. So they are capacity and consent. So obviously you've already gained consent and you should have a good idea of the patient's capacity, of how they've been behaving with you, relationships. So that should be mentioned in the document you've been given, but just have a chat about with the patient so you're showing the examiner you're looking into it. major life events, so anything, you can just ask them. They might have something gone on recently, like a loved one die, something like that, they will tell you. Living situation, patient self-care, so most likely your patient is going to be independent and they won't need any help like washing and dressing, that kind of thing, but just make sure you've checked it off. Okay, other points is non-adherence to medication. So we have already mentioned that. How are you getting on taking your medication? Do you need us to help you with it? That kind of thing, just so you have a general idea. Current risks, so just have a chat with your patient. So that you might have a patient who's like suicidal or something. So you just need to mention that you're looking into that and that you're aware of the risks. So I can see, Peter, you've been not feeling great at the moment and you've been wanting to harm yourself. So obviously we're going to make you as safe as possible while you're here. Just something on those lines so the examiner knows you are aware of it. Okay, so the other points from the marking criteria are quite general things. It says like body language needs to be open and you need to do active listening. So if you don't know what that is, when the patient is talking to you, you really need to listen to them and engage. Don't talk over them, but repeat back some of what they're saying so they know you've understand them. Ask questions, that kind of thing. Really get involved. Try not to switch off, okay? When you feel like you've covered everything for your station and you've covered all those bits we've mentioned, you can close the station by asking the patient if they need anything, telling them, to let you know if they need something, that kind of thing. Then decontaminate your hands. At this point, if you have extra time, I would recommend with all of your stations, double check your paperwork, try and relax for a minute, and then in your mind, go through, have I covered everything? We can just quietly stand there and do that. I would not recommend asking your examiner to stop the clock until you're 100% you've covered everything. Because at this point, if you've got 2 minutes left and you think, oh no, I forgot to ID the patient, you can say, examiner, I made a mistake. I forgot to ID my patient, and you can do it now and you will still pass, okay? So that is my top tip with all of your stations with that one. Okay, and as always, good luck with your exam.